Let's talk about sinusitis. There are 40 million sufferers that suffer from chronic sinusitis each year. It's a very common illness. People think of it as, oh, my nose is stuffed, I have another infection, they don't go away. The symptoms can be yellow-green discharge, postnasal drip. Your sense of smell and sense of taste may be a little bit off to a lot off. Hoarseness, cough, postnasal drip, headaches. You could have headaches in your forehead, in your cheeks, around your eyes. They could be devastating. They could be some mild headaches to feeling like someone put an ice pick through your forehead. You could have problems with your ears when you fly. You could have problems with your ears when you don't fly, where you feel congested, where your ears don't pop, where you have ringing or buzzing, or hearing loss, or dizziness can be due to chronic sinusitis. You could have yellow, green, brown, phlegm. You could have nosebleeds as a result of sinusitis. So there are so many different symptoms that sinus sufferers suffer from that really needs to be looked into by a sinus specialist before it gets worse. And it's actually considered one of the disease processes that actually drastically decreases your quality of life. So it's very important to take a look at it. We've coined the term CAID, chronic airway digestive inflammatory disease, which shows that sinus problems are connected to allergies, asthma, snoring, sleep apnea, and GERD. And we have 40 million sufferers with sinusitis. Once you throw in allergies, snoring, sleep apnea, and GERD, you're looking at about 120 million people that suffer in the United States. So if you're a sufferer, you're not alone. You shouldn't be embarrassed that you've been to a doctor or multiple doctors to try to treat this, and you're still not feeling right. Chronic sinusitis is the #1 cause of missed work days and missed school days for adults and children. And it's also the #1 cause for decreased performance at work and at school. So therefore, treating this is very, very important. First thing is you need to get to a doctor that's well-versed in chronic sinusitis so that they can do a very, very comprehensive workup to figure out what's really causing your chronic sinusitis. And the first thing we do is we try to treat those patients medically, and depending on what the problems are that's leading to your chronic sinusitis, whether it's the environment, whether it's pollution, whether it's allergies, whether it's infection, and that infection could be viral, bacterial, or fungal, and it may vary at times. It may be a combination of those. Our treatments are targeted towards those. And if there's an anatomic issue, your septum is crooked, or your turbinates are swollen, or your sinuses are blocked, then surgery may be required. The good news for those people that have failed previous medical treatments and have failed previous surgical treatments, for those patients, there are new treatments that provide them a real chance for improvement of their symptoms. And the next good step is for those patients that have had or not have had nasal or sinus surgery in the past. The new surgeries do not require any packing. There are very rarely any black and blues. There's minimal discomfort, and most patients are back to work the following working day, or school day for that matter. For those that have chronic sinusitis, it's really important. Don't be embarrassed. Get to a specialist that really understands sinusitis and let them help you.